So, Alice, welcome to the podcast.
Well, thank you, Millie, and thank you for inviting me. It's a pleasure to be here.
Well, it's wonderful to have you actually, because this is a topic really close to my heart. I was going to start, I know you're here to do the talking, but I was going to start by telling you a story, which is just so, I think it's so funny. I think you'll love this. So it was January 2022, and I was
Yeah.
asked to go on BBC Radio Scotland, and I can't actually remember what I was actually on to talk about, but I was on with an obstetrician. I think it was something to do with rising cesarean rates. And the
Okay.
doctor that I was on with said that the reason why women were having more cesareans was because he said it was because they have fatter vaginas. I'm going to read you what he said because I wrote it down before we spoke because I just knew you'd love it. I knew it would make you happy. Right, wait for it.
Mixed emotions are flooding through me. Go ahead.
Well, I just thought we'd
God.
open with this,
Ooh.
increased
I used to
increased.
work in Scotland as well, so but yeah, my
Well, I
brain's
won't name
scrambled now. Go on.
I won't name and shame the guy, but it doesn't really matter what
Sure.
his name was. He doesn't deserve any more fame than he's already got. You can find him if you Google fat vaginas because he kind of went a bit viral for it. But he said
Yeah.
increased fat tissue in the birth canal, by which he means vagina, which makes the birth canal that much narrower, which makes it harder for the baby to squeeze through. So you're more likely to end up with an obstructed labour. Um,
Okay. Oh God.
yeah, and actually at
Oh.
the time I was on in this same room I'm in now actually, but on the phone because obviously it was a Radio Scotland, and I kind of stood there and they went to hear he was talking, and then I was stood there just going, with my chin on the floor, and then they said, and anyway, now we're going to play you Rick Astley or whatever, and off they went. They disappeared, and I was like, no, no, you have to come back to me. I have to talk about the fat vaginas.
Oh my goodness. Yeah. I mean, I wouldn't know. I just wouldn't know where to start. So yeah, I mean, like props to you that you wanted to get in there and retaliate. And but I would, it would take me a while to order my thoughts about that and kind of respond to it. I mean,
Well,
um,
I mean, I only opened with it because I just wanted to talk really not about that because that was a ridiculous thing that he said, but kind of about this idea that women with a high BMI or a higher BMI are somehow to blame for intervention heavy births, for the rising intervention rates in childbirth, or even just the idea that they are going to have a more difficult birth because of their BMI, which is what I want you to talk about, really. I just
sure.
thought that was a funny story to start us off.
Yeah, I mean, and it's a bizarre story, and it's got and you can laugh about it, but actually, some people will remember that and believe that and wonder about that, and fat phobia is completely real. So women with a high BMI or plus size women will hear that. And that will add to their worries, and also it will add to their shame, and it's absolutely it's a quirky story, but that
Yeah,
taps into the myriad of ways in which women are made to feel worried and ashamed, and it's not it's just really as far as it being damaging, it's one thing, but it's also not necessary. There's my main um, passion really through my career has been to dispel this myth that I believe now exists, that if you are plus size, you have a raised BMI, that complications are likely or are inevitable. Because I think that the relentless focus and weight stigma leads to that with a lot of health professionals, and definitely leads to it with women whose pregnancy experiences can be really blighted, and actually their birth experiences and outcomes sometimes can be really seriously affected by that.
what does the evidence tell us about women with a higher BMI and childbirth? What are the facts?
Yeah, so I mean, I'm going to Google that about the fat tissue inside the birth canal,
I'm sure it's
to
complete
eloquently put
nonsense.
it, because now I'm thinking I'm going to go and see what I'm going to go and see where that came from. So I've got a long
I'll
background
tell you
in.
now, I have Googled it and there is nothing that you won't find
Okay,
anything.
okay,
You'll just find
um,
that doctor.
great, yeah.
Hmm.
Um, But so I've got a history. Is my history, my background is as a clinical midwife, and then I worked in clinical research, and then I did my own PhD research looking at women's experiences of being plus size in the pregnancy care system and having pregnancies. So I've got training in research methods, and I'm always, as a midwife and as a in it, all of the work that I do, I want to look at the evidence, and I want it to be much less frustrating than it is. But I kind of decode it and debunk it for people when they ask me to, and it can be difficult to wrap your head around. But basically, there are lots of different aspects of pregnancy, complications of pregnancy, that when you look across the whole population of women, might be more likely to happen if you have a raised BMI. But it's a might. It's in the mix and kind of confounded by lots of other different variables. It's across all complications, it's a small increase in risk. For example, mostly it's kind of pregnancy that increases the risk for everybody. So things like blood pressure problems, diabetes, unfortunately, pregnancy can introduce that risk for some people. And it's incredibly difficult to predict that. It's impossible to predict who these problems will happen to. And BMI is kind of one of many potential factors. But nobody can tell anybody this is going to happen to you because, and in fact, so if people are concerned about specifics, I'm always delighted to dispel their fears around things that lots of people really do worry about in pregnancy, because they're pregnant, they're only human, right? And you're anxious about this precious thing. Things like stillbirth, things like diabetes, things like babies getting stuck in the birth canal, all these things that the wonderful internet can throw a million different unfiltered stories at you about. And it brings me great joy to just reassure people that the chances of these complications are so low, and it brings me huge frustration that there's such a relentless focus on it, and that in itself, for a lot of the complications that can arise or the interventions that can happen, makes all of that actually much more likely in really complicated ways, because it undermines confidence. It means that women listen to these to being told that there are rules and there are restrictions and there are things that they ought to do, and interventions that they ought to say yes to. So it really undermines their confidence in their bodies and their ability to fulfill that natural process. So whenever I talk about, I always lead with this: if you are plus size and pregnant, at whatever size, the overwhelming likelihood is that your pregnancy and your birth will be free of complications, straightforward pregnancy, birth, and a healthy baby. And I tend to repeat it a couple of times whilst I'm speaking, because it needs that, that reprogramming needs to happen. It's just such a frustrating, dangerous focus.
Yeah, and I guess what you're saying is true for all women, regardless of their BMI, really. I mean, the chances of the outcome being a positive one are,
absolutely,
by far the most likely outcome for everybody.
Yeah, and there, because I teach, so I run a sort of reassurance service. So I talk to plus size women all the time, and a lot of the time when they come to me because they're plus size, and we're talking in that context. So there are kind of clinical guidelines, interventions, screening, things that might be advised. So I can talk them through all of that. But a lot of what we talk about, it's just universal. It's just, plus size pregnancy is just pregnancy. And being plus size is a consideration. It's not a complication.
But you
might get a complication, but sorry, go on.
No, sorry, but do you think they are specifically worried because they are plus size? I mean, is that why they're specifically coming to you? Are their anxiety levels even higher than someone who isn't plus size?
Absolutely. Yeah,
right. I mean, because they're being told what? Where are they getting this from, do you think, this anxiety?
Well, so I think so for example, when I I teach in a university, and when I teach in the university teaching students, and I talk to them about plus size pregnancy, my all of my experience of clinical care is that actually, for most pregnant women, when they come to start their pregnancy care, which is around about 10, 12 weeks, often when they have their first appointment, or perhaps a bit earlier with the midwife, a lot of them have done a lot of Googling by then. And there'll be things that they're worried about. There'll be something that they're worried about. So I always encourage students that's how you start your booking appointment. So the first appointment with the midwife, that's how you should start. How are you? What's on your mind? Is there anything that you really definitely want to talk about? Anything you've got concerns about?
Yeah.
And I teach that specifically regarding plus size, because actually that can be a way to give that power back to that woman to raise it in the conversation, because it can be a sensitive issue that student midwives might worry about raising.
Right.
And sometimes they do it really badly, and they try to ignore it, and they discuss it in really poor ways that sort of in a roundabout way increases stigma. So that's how I encourage. That's not really how a lot of midwives do it. They do it in a checklist fashion. You're booking and they just want to get a big medical history from you. So often plus size women will have Googled all kinds of stories. They'll have, they've been on the internet, and so they found what the internet has to offer. So they will have some concerns. When you're pregnant, you're concerned about your health. You're concerned about being the healthiest that you can be. And so that does, for most people, enter into their thinking. And for different people, it means completely different things. So some women, will have a really a sort of traumatic relationship with food. They'll have been kind of perhaps serially dieting all through their lives, weight cycling, feeling like they're in a battle with their own bodies. Other women really won't be like that at all. They'll see their lives as they're as enjoying food. They don't particularly feel that being plus size is anything for them to worry about, or anything that they would want to change. And kind of combinations of that and everything and anything in between. So it's not about making assumptions about that, but pregnancy brings that focus on and concern, because it's that kind of unique physiological state, and you're now having a baby.
Yeah.
And what they're presented with often, even if they look on sort of public facing websites from charities, for example, Tommy's the baby charity. So one of the things that drove me actually to finally get my PhD funding and do my PhD on this was that at the time I was working for Tommy's the baby charity in a research role, and one of their clinical research focuses was on obesity and pregnancy, and in inverted commas, and their website, which was the sort of the public facing, so anyone can just look it up for information, said, I used to have this written down, it's on a document somewhere, it said, and I'm fairly sure this is word for word, if you are overweight or obese when you are pregnant, you are 4 times more likely to die during pregnancy, and the same risk goes for your baby.
Wow.
So it's not there anymore. That's right. Like maybe 2012, but the issue there, the issue there is obviously that's horrifying, and it should never have been there. And the 4 times thing, that's always your kind of mainstream media representation of risk, and often, across lots of different information sources, that relative risk representation will be how it's presented, because it's simple, right? It's a simple representation of numbers, but it's really frightening, and it doesn't tell you anything about your risk. Actually, it doesn't tell you anything at all, because you're 4 times more likely to die. It isn't true, but your risk of dying is tiny,
well, isn't it? Yeah, like they tell you your risk doubles overnight, sort of thing. You think, oh my god, it doubles. That makes it sound huge, but if it's doubling from 0.01 to whatever,
which it is, which in all of these cases it is, so your chance of dying is tiny. It's tiny. and so all of these things, and the same thing with stillbirth risk, with diabetes, all of it is you are so much more likely um to have a complication-free birth as you start out, when you conceive, and all of these influencing factors which undermine your confidence and make you feel worried without explaining to you what the numbers really are, and that actually,
Yeah.
in the vast majority of cases, everything is just fine.
Tell me about how birth is managed for plus size women, and whether those numbers that you're talking about, or maybe those attitudes that underpin those numbers that you're talking about, enter into the birth space and make birth different for that woman.
Yeah. So, one really key point that lots of people come to me with is that they are a lot of women find that there is an attempt to restrict them from, in terms of choice of place of birth, which
Yeah.
obviously is a really key choice, specifically around home birth, or having their baby in a midwife-led unit, and associated with both of those choices using water, so during the birth or for the actual birth itself.
Yeah, I've heard that a lot, actually.
Yeah, you will have done. And so you have what you get into all these descriptions of, I've been told I'm not allowed to do this because the cutoff is a BMI of 35, or actually it varies, and it doesn't exist, but the guidelines are there, and they're not rules. But what women have to do is they have to kind of go through the process of accessing these gatekeepers, often via their own midwife. They need to find whoever is the person that they need to talk to, who will then have a discussion with them about using water and how it's not advised. Or they may be sort of more sensible and more and have have a better conversation, which generally ends up with them signing a piece of paper saying either I've discussed the risks, or yes, I can get myself in and out of a pool. Because that's off. It's the mobility issue, the moving and handling issue, which how insulting is that?
Well, that's what I was going to say, because that's what I'd heard, but I wanted to sort of hear it from the horse's mouth, is whether that's actually, I've heard that anecdotally, that's what women are being told. It's because you're so big that, if you're unwell in the pool, we won't be able to get you out. Is that right? And is there any evidence for that, or anything to support that?
No, there's none. And actually, I did actually hear that, and I need to check this out, that one of my local trusts is changing this, that there is actually going to be a breakthrough on this, which would be fantastic. I, as a clinical midwife, have alongside a colleague, physically lifted a woman out of a pool when she had a collapse, just after having given birth in the water. I do not remember what a BMI was, but anybody that's in a high-sided, rigidly structured birth pool that's full of water, who has collapsed and who is slippery, it's very difficult to maneuver. And all of our moving and handling training tells us that we do not physically go into the pool and manhandle them out of the pool. What we need to have is equipment for everybody to be moved in and out of one place to another, regardless of the BMI. So it's just a red herring.
Yeah, because actually, now that you're saying that, I'm thinking, well, any woman would be difficult to maneuver if she collapsed in a big pool of water.
Indeed.
That's the problem. It's not how heavy.
Very, very difficult.
All women are quite heavy in terms of moving them out of a big pool of water.
Yes, it was difficult on that occasion, and it's just not, and it's not, hospitals have robust moving handling policies. We have to update our training on the way that we move and handle, and it doesn't include doing that. So they ought to have moving and handling equipment and policies. And in terms of whether if it's not an emergency, if you just need to get in and out of the pool, then I think that yes, very shaky ground if you're saying to somebody, we don't think you can get yourself in and out of a pool.
Right. What are they saying about home birth then? That's the reason why plus size women can't necessarily have a water birth. What's the barrier to home birth for these women, or midwife led unit? Let's talk about those two options, those two choices.
Yeah, so again, so the guidelines tend to be the same. They vary between different trusts, but they are, they tend to be restrictive. They are restrictive. So that is based solely on that there's theoretically a small an increased risk, a small increased risk of things like excessive bleeding after you have your baby.
Right.
Which is very difficult to predict, but it is relatively common. It's probably the most common obstetric emergency that midwives and doctors deal with. We're very, very good at dealing with it. We are equipped at home birth to deal with it, so we do deal with it. So it's that kind of red herring. And also another thing that I always try to emphasize to clinicians, but mostly to women, is that if birth is part of the pregnancy, it's just the end bit of the pregnancy. And by that I mean, if you've had no problems in your pregnancy, then there is no reason to expect you'll have any problems during your birth. So you should be making a plan, an individualized plan alongside your expert caregivers about what is suitable for you, what is safe for you, and what your preference is. So, we talk about evidence-based care, and my students always kind of roll their eyes and groan because it sounds so uninspiring. But to me, it's a combination of, yes, you're bringing in the best evidence about, let's say, risk, but you're also looking at what's available in terms of expertise, who's there to look after you, and what do you want? What's your preference? Because women just need to be given that information. I can simplify it for people. Once they've got the information, it's their body, it's their birth.
Yeah.
So
and I
it
think
should
another
never be as simple as well, there's a bit of an increased risk of this or that, so it's not advised for you because
yeah
your BMI is that. So all of it is just really binary and the opposite of individualized care.
Another thing that I was going to just add in about home birth, because just in case there's anyone listening to this who is pregnant, is that this whole thing of like the emergency, and just to say, and I'm sure as a midwife you'll back me up on this, that midwives can see problems coming a long way off. So this, I mean, just when you were talking about the pool and everything, it reminded me of when I was pregnant with my first baby and I was planning a home birth, which I didn't have in the end. But I lived on a 3-story house and I wanted to give birth in the bedroom, which was the top floor. And the midwives, when they came to do the sort of, they had their clipboards and came to assess whether I was allowed to do that sort of thing.
They're worried. They're worried about your floor.
They said to me, and I was already absolutely terrified of giving birth. And they said to me, well, we're just a bit worried if they have to stretcher you out, then they won't be able to get the stretcher down the stairs because the stairs are quite narrow. And I was like, right. And when they went, I was like, oh my God. Just this vision of it being so, the situation being so severe that I was going to end up being put on a stretcher on the 3rd floor of a house and have people have to carry me on this stretcher down all these flights of stairs. It just, and I think when women are told these things, I don't think when people realize the impact that they have, like you were saying about the 4 times more likely thing. People don't realize how that's going to land with a woman who hasn't had a baby before and is really, really frightened. No. And that sort of whole thing of picturing this kind of like huge blue light emergency, I think really happens often in pregnant women's minds. Whereas in fact, like I said, with home birth in particular, they can see the problem coming off, a million miles off, if there is going to be a problem, which there isn't very often.
So I've looked after women at home births, and I've looked after lots of plus size women at home births, and I've looked after lots of women who have ended up transferring into hospital, and it's never been in a blue light. It's certainly never been on a stretcher. I've never ever seen anyone on a stretcher.
I know.
Never. So the reasons that women tend, in the vast majority of cases, to abandon their home birth is because they change their mind about their pain relief. They want pain relief that isn't available for a home birth, or because it's taking longer and there's longer than expected, and the baby's in a position. What I'm saying is there's some kind of a slowly developing kind of complication that's in no way a blue light emergency or anything that causes drama or anything that could be, in a Holby City type situation. Those sorts of programs are not helpful either, are they?
No.
But absolutely, lots and lots of women who are plus size give birth at home, and the example of bleeding a bit more than expected after having had your baby is, again, it's something we're just very vigilant of, and that's what you want, right? You want, right. It doesn't happen a lot, but it is, the most common emergencies that we deal with, and we're really, really good at managing. We've got brilliant drugs. She's got brilliant we're really lucky. We've got all the things that we need.
All those systems are in place, and all those drugs are there at home as well as in
hospital. Yeah, quite.
But is a woman's size used to coerce her, do you think? Is it actually, an issue that women who are plus size are being made to feel like hospital is, even more so than a woman who isn't plus size? Are they being made to feel that birth centre, water birth, and hospital birth and home birth, are not for them?
Yeah, so there are guidelines that come from the Royal College of Obstetricians and Gynecologists in the UK, or the American College in America, and so there's a kind of list of things that are recommended to you if your body mass index is above a certain threshold. I mean, there are variations, but it's basically 35. If your BMI is 35, you get all this sort of gamut of recommendations, and one of them is that you are what's called consultant led. So you're under a consultant, and you're recommended to have your baby in a consultant led unit, which means a labour ward. Now, women in inverted commas negotiate to have their babies at home or in birth centres, and so they have to kind of do that work. They have to kind of opt out of what's recommended to them,
and they have to know that they can do that.
Yes, exactly, and it's not clear. It's. I mean, one woman said to me a while ago now, I'm not sure. She was sort of musing on the fact that she had no complications, and she said, I'm not sure what happens if I don't get any complications. And they just say to me, there's nothing really wrong with you, you're just fat. Probably I'll just need the same rules. And that, that actually is where a lot of the frustration for women arises. So I've spoken to so many women having a second or a subsequent baby who look back at their first experience when everything was new, and they were kind of, often accepting what they were being told, and they didn't know that there was a different choice, or that they could say no, or they could ask why, or what if we don't do that, or what are my options, and then they're retrospectively now feeling very frustrated by that experience. And that is in particular for women, as you'd imagine, for women who fell into this BMI bracket, but they didn't have any complications, but they maybe were in a lot about having induction, which is kind of the real biggie in terms of intervention, and that clearly has a huge effect on your experience. And for a lot of women, your birth and your outcome, and whole kind of cascade of interventions, as we call it.
It sounds like BMI is just a compounding factor. I mean, obviously, we're already in a situation where lots of women don't know that they can say no. They don't know that they can challenge or ask, what if we do this? So, try and find a different path. If they're told this is what's happening, you can't have a home birth, they take that as, as given. But then layer onto that being plus size, and you've kind of got an anxiety in the woman as well, brought about through the Google and the stats and the kind of like air around it that is making it even worse, making them even more likely
Yeah.
to be sort of pushed around, really.
And the other thing really is, so you have this list of kind of recommendations that you'll will be presented to you when if you sort of rock up to the midwife when you in early pregnancy. So consultant-led care, you might be recommended to take aspirin, you might be recommended to take blood thinning injections, anticoagulants. You'll be recommended to possibly to see an anaesthetist for various different discussions. You'll be recommended possibly to have serial growth scans, and they are really complicated because scans are not scans are a really imperfect technology. These scans happen later in pregnancy, and they are a source of people like them, women like them. They are but they're a source of reassurance, but they're also a source of anxiety because they can tell us, they just tell us different information that can conflict with maybe the last scan, and often they are the start of that cascade into recommending an induction, because it's kind of thought that perhaps you've grown a baby that's possibly going to be a bit too big if you wait, and that's a very imperfect sort of estimate. And glucose tolerance tests, and there are lots and lots of different things that are recommended, and lots of things that are recommended for good reason. But the way that it's presented, and the sort of the kind of what's it called? Not a golden arrow, but it's presented as, if you do this, this'll all be fine. You need to do this, accept all these interventions, accept all these restrictions. We'll keep you safe. You need to do this because of your BMI. And there's just so much kind of nuance and the unknowns around it that's just really not discussed in any detail. And that's before you even throw in the potential for sort of disrespectful treatment and kind of stigma that is all wrapped up in, that kind of the hierarchy and the sort of the dynamic within that medical interaction that you've got going on.
And I was just thinking while you were talking, a question that I should have asked right at the start is, what percentage of the population, let's just think about the UK, falls into this high BMI bracket? What percentage of pregnant women are over that threshold where they're already stepping into that zone of all of these interventions?
Well, it's sort of 1 to 2 in 4, 1 to 2 in 4 women.
Wow. So 25 to 50% kind of thing.
Yeah, are in that bracket of BMI of 30 or more, and that's clinically obese in inverted commas. So
this is really at the root of it, isn't it? I mean, this is a massive problem, because this is driving all of the stats that we see when we see all these rising interventions.
Yes, it really, really is. Age and weight.
Yeah.
Obviously there's loads more complexity around rising induction and cesarean rates, and other controversial reasons, but those are real biggies. Really.
Is age and weight being used as an excuse or is it valid? I mean, that's the burning question in a way, isn't it? Is it valid to treat women differently because they are older or bigger?
It's only you should give advice to women. You should give them information in the form that it makes it clear what you know and what you don't know, what the evidence tells us that it's really not clear. There might be an increased risk in as much as this across a whole population, and that's all we know. And it's not, it's really not. It's not easy, it's not simple to explain. Things like 4 times more likely or 1 in 2 is much easier way for people to explain things, isn't it, and to understand. And that's why, that's why when you go down the supermarket and buy the Sun or the Mirror, that's how things are expressed in there. They don't start talking about population level epidemiology, but unfortunately that's how the guidelines are written.
Yeah.
So so that it's really important that we have, that we've got all these safety mechanisms in place, so that you are offered to have a glucose tolerance test during your pregnancy, because we know that there is an increased risk if your BMI is higher. But what women tell me is that they're sort of a lot of them they're like, well, I passed my GTT, I passed my test for diabetes, and then I got told that I should probably do it again because I'm bound to get diabetes because of my size. and it's just it's the communication around it, and like I said at the very start, there's sort of expectation of complications. It's so much more nuanced and complex than just someone's size means this is going to happen, because it absolutely isn't the case.
So before we say goodbye, Alice,
Mm.
we talked quite a lot about how, we were just talking about how being plus size, it sounds a bit doom and gloom, that it sounds like it can have a negative impact on a woman's birth experience, because from the outset she's treated differently, she feels differently, her choices might be restricted. It all doesn't sound very positive. I was just wondering if we could end by you saying a little bit about, what a pregnant woman who is plus size can do to, turn things back around for herself.
Yeah, I mean, and I am I was struck by, so I was rereading your book, Give Birth Like a Feminist, and was struck by, what I try to do is help women to kind of flip that dynamic, so that it's when they're pregnant, it's not, they're going to go along to the specialist and the midwife, to take advantage of their expertise and their knowledge, but they are in control of their own pregnancy and their own birth. And it's about building up that confidence that actually I know that the most likely thing for me is that I will have no complications, and I know that I know how to look after myself, and I am healthy. I can get advice from a dietitian or a midwife about healthy eating, although frankly it's rubbish. What we have is very poor evidence, and it's a massively under-researched area. So we have no special advice that we can give to women. Women often feel kind of stigmatized, or at least that it's kind of useless, the advice that they get given. There's nothing that's specialist or geared to plus size women. And also there's an underlying assumption felt that your eating must be problematic and it needs to be sorted out by you being educated and kind of health promoted too. So my assumption is that you, as an individual pregnant woman, know, I can give information, but that I'm not going to assume that you need me to educate you on how to be healthy. I can definitely talk about specific lifestyle and food advice pertaining to pregnancy, but not to plus size. So take advantage of, and think about those caregivers as being in service to you. That's how I think of myself. How can I help you? It's your decision. It's your baby and your body. I've got the expertise and the knowledge that can help you. And so it's kind of that mindset. So arming yourself with knowledge about how actually it doesn't matter what I've seen on Google, or what other people have told me, or what my mum's worried about, or anyone else has said to me, or I've seen on the internet. These are the facts. The facts are that it's most likely that I'm going to have a problem-free, complication-free pregnancy and birth. I'm going to work on that basis, and just proceed as in, it's BMI plus size is a consideration. It's not a complication. And my tips for going on to appointments: make a list of questions. So what's really important to you? Write down what's really important to you. What's your ideal outcome? Make a list of questions. Ask lots of questions. Write down some notes of answers. Why is a good question, like a child when it goes to that stage of asking why. Keep on asking why. There's a lot of time pressure in the NHS, and most people in this country are using the NHS. But that's not your problem. You need to get the information that you need. But be aware that the time pressure will be real for that health professional. So you need to have your agenda. And then always have a support person as far as you can. Take someone with you that's totally got your back. And again, don't let that be somebody who, often women have, a lot of women have, if they're plus size, have someone in their family, or someone that's just, they're trying to be helpful, but they're not saying the right thing. That they're feeling worried about their size, and they're not saying the things that they need to hear. Someone that's really got your back, who's totally on your side. take them so you know you're going to have a birth partner, but have a pregnancy partner, have someone that's going along with you. You know, if that's not your life partner, if you've got a life partner, they can't go to your appointment with you every time, then somebody else, and they can kind of take the notes for you and then help you kind of consolidate and think about what's happened after all your appointments. So treat it like a project. You know, get the knowledge that you need and think about what you want. Don't think of yourself as waiting to be told what the rules are or what you can and can't do. Those would be would be my kind of my broad advice for the
Well,
plan.
yeah, I kind of want to hug you because I feel like you're speaking to all pregnant women really and giving
Ooh,
such sound advice,
again,
you know,
yeah,
for everybody. To take, you know, to take charge of your birth experience. Don't be afraid to ask questions. Don't be afraid to, keep asking those questions, and
yeah.
ask for the evidence and ask why. And all of those things are just peachy. So thank you for saying them. And
That's fine.
thank you.
Oh, and one more thing which I
Yeah.
got sidetracked from when I was talking to midwives and students. So if there are any midwives, birth workers out there working, wanting advice about when plus size women. So if you want to get into the mindset of most plus size women when they come to you when they're for that booking appointment, I was saying they've been Googling. So your main job at that point is not, as the guidelines tell you, to have a full and frank discussion about all the risks that are associated with plus size pregnancy. Your main job is to reassure,
Yeah.
because lots of women are just frightened by the time they come and see a midwife. So, and again, that's for all women. Yeah, that's your main job, is to reassure, get to grips with the stats, you know, feel confident with what you're talking about. Um, don't just say, oh yeah, your risks are raised. You know, you can do better than that, and you
Yeah.
need to do better than that.
And women deserve better than that.
Yeah,
But you
definitely.
know, the work that you're doing is great, and I'm going to link to you underneath the podcast so that people can find you, and maybe you can give me any good links that you think would be helpful either to maternity workers or to pregnant women who are trying to navigate this territory. It's been really fascinating speaking to you, and I'm
Oh,
really
I've
really
really enjoyed it.
grateful.
I'd love any opportunity to talk about this stuff. It's really, really important and my passion. So thank
Good.
you. Thank you for the opportunity.
Well, I hope it gets people thinking and talking as well about this because it's a really important issue. Like you say, it affects so many pregnant women because so many women fall
Mm.
into the category.
Yeah.
So it's so important that we keep talking about it and asking why.
Yeah.
Yeah.
So
Thanks, Alice.
thank you, Millie.
Thanks so much.